I usually go for my neck, and I'm always uptight, all in here, and I get migraines all the time. So I go to a neurologist too.
Okay. Where do you get migraines at?
Usually behind this eye,
Okay.
through here.
Okay.
I might have something. I always have a stiff neck though.
Oh,
Always. Like,
yeah.
usually he'll hear me like
And
say
then
something about it.
Arm hurts.
Yeah. I guess I get so used to things. Yeah.
Yeah, absolutely.
Yeah. Like sometimes I'll have numbness in here and
Okay.
in here, and I went to my PCP and he said most likely it's a nerve somewhere up in here because
Okay.
it goes down. He said it doesn't seem like how did he describe it? He thinks it's one that goes in the lower inside.
Yeah, like a C18 one.
Yeah,
kind of
something,
thing,
and
kind of
then,
like way down below.
yeah, but once again, he also said the same thing my chiropractor said, which is I'm super uptight,
Okay, yeah.
so I'm a
Yeah.
uptight individual, so.
I can kind of just look
Yeah,
and tell you
it's
if
all
you've
right
got
here.
like a little bit of
Mhm.
tension, like right here. A little
It's
bit
like
more
that
on
all the
your
time.
right side. Has anybody ever discussed this thing called Thoracic Outlet syndrome with you? Okay, so, all the neck, all the nerves that come out of your neck, like basically like C5 through C8 go into your arms, okay? Supply your arms with like nerve, just like you feeling your muscle strength, your sensation, reflexes. Right here on the side of your neck, you have these scalene muscles that kind of like help to like turn and, you know, tilt your head, but also do a lot to like stabilize your head on your spine. And they get really, really tight. And this whole area right here is called your thoracic outlet because this
It runs down.
is your thoracic. Yeah, and I mean, all these nerves come down and like out underneath of your arm, like in your armpit here. So a lot of this can cause like numbness and I mean. Like,
Yeah, it's always on,
temperature
it'll start with
differentials.
these two, it'll come down, it'll be through here.
Okay. Now, have you had any accidents, like any neck injuries?
I used to do
injuries?
dance and gymnastics,
Okay.
so even when I was in high school and cheerleading, so just, my spine has that little curve and stuff like that, just from banging down, tucking and not tucking sometimes
Okay.
more than I,
You ever gotten any x-rays or anything like that?
not since I was younger.
Okay. Anything else into your other arm and your left arm?
I mean, I have,
Numbness or anything like that?
both my wrists and just from jumping and things like that, you
Okay.
know, like if
Yeah.
there's too much wear and tear, like if I do too much, it'll hurt in here, but that's norm for me.
Okay. Anything below your neck, any injuries, anything like that, any reason you went to the hospital?
No.
Or anything like that? Nothing, no
No.
car accidents or anything like that? No serious falls onto your butt or anything?
No, I don't think, no, not that I know.
Alright. Pain, numbness, tingling into your legs, feet, toes, anything?
No, just the normal age thing.
Bummer, yeah,
Yeah,
I get
just the
it.
normal, like, you know, knees when it's like a certain type of weather. Yeah, I've always had migraines since I was like 9.
Okay, what about
And
your arm
then-
pain?
That started, do you remember when that started? My arm, that's probably like 8 months, maybe
8
9
months
months,
ago.
something like that.
And
Yeah.
nothing, no, like, inciting, like.
Well, I started going to the chiropractor around the same time that I went to the neurologist.
Okay.
So I was doing both.
Uh-huh.
And then I stopped going to the chiropractor. And a little bit after that is when I started getting that numbness. So I don't know if it's just because I wasn't going and getting adjusted and I was still, you
Okay.
know.
Yeah, before you stopped going to the chiropractor, you done
I
this
didn't
like
have
pretty
this.
regularly?
Yeah,
Okay.
yeah. I didn't have any of the numbness in my arm
Okay,
prior to going.
okay. Alright, I'm gonna like do some muscle tests and stuff like that, get your sensation, your reflexes and stuff like that.
Okay.
And we'll see what's going on. If anything like points me back to your spine, I'll let you know.
Okay.
Since you're having some stuff right here, I'm gonna kinda go backwards in this whole nerve test, so, wrap your fingers right in mine. Hang on, yeah, now go. Don't let me pull out like this,
Okay.
right? Squeeze them, ready, and hold, ready, good, ready, and hold, ready, and hold. Just a tiny bit,
Yeah.
right there.
Cause this is,
Okay,
I'm
that's
just just
hurt
always
at
used
all?
to, no, I'm always used to it being
Just
like a
like
little
guarding
like
right there.
numb, like ish, you know,
Okay.
like,
Okay.
I don't know.
Hold your fingers out, real stiff, don't let you press them together.
Mm.
Let me hold right here. Hold right here. Good. Let me hold here. Good. Hold here. Good. Squeeze together. Don't let me pull hard. Good. Hold. 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 Good. Over here. Hold. Good. Might have just a little hesitation or something like
Mhm.
that, like maybe you're guarding or something like that. I wouldn't necessarily say it's weak.
Yeah.
Wrists up like this, like curl your hand, curl your fist, don't let me pull down like this, ready? Hold. Good.
Funny, cause Nick will tell you I'm not a relaxed kind of person.
You have a little one right there. Clench your teeth. Okay, that's a little bit better. I can get your mind away from that. Good. Look left for me all the way. Any pain anywhere?
No, just tightness.
Tightness right there. Should have said one more time. This is the last time. One time up and down. Okay. Can you bend over and touch your toes while you're sitting there?
Oh, while I'm sitting?
Yeah, while you're sitting. Any pain with that?
No, just tight, just,
Okay, right there.
I don't do anything, yeah.
Okay. Stand up and look at some things. Okay, come on back up. Alright, put that face down. Just gonna like palpate, feel around on your muscles. Press down on your spine a little bit. See what's going on and where. The pain whenever I press through your arm.
Just tight.
Just tight, yeah, it's pretty tight. Normally, like in a lot of your joints, you should have this like kind of elasticity, like a little bit of a springiness, and you're not doing bad. I mean, you're pretty stiff. You got a lot. You're a little bit more like a board than a spring right now.
That doesn't surprise me, honestly.
But we get these joints moving and you'll do a lot better. Like you said, it's weird when you get used to. You forget how good you're supposed to feel.
That's what it is. I'm just kind of used to, so.
Yeah, never take care of yourself. I mean, I was just thinking about how I'm just as stubborn as everybody else about getting help for myself. Let me know if anything is too painful for you, if I press too hard.
Oh no, I'm good.
Okay. So it's, your muscles and everything are pretty typical, you know, just a lot of people needing some good adjustments that haven't been adjusted in a long time, just, you know, kind of but just like victim, like stress in your body and stuff like that.
Well,
Posture.
and I'm a slouch. Yeah, I was gonna say I'm a
I was
sloucher
just
too.
about to say,
Mm-hmm.
your posture has a lot to do with this, like from here to here.
Yeah. Well, even when I sleep on my side, I sleep curled up in like a little ball anyway.
Okay.
So everything's always
So you're
inward.
always curved over
Mhm.
right here anyways. So I can, whenever I touch your back and everything's really, really stiff, it's a lot of the times it's indicative of like these muscles just being overstretched, and that
Yeah.
goes back to your posture. So whenever these get overstretched, that means your muscles in the
I'm not-
front,
yeah.
are pulling, and whenever your muscles in the front are stronger than these muscles most of the time. So these are working way too hard to try to pull everything back this way and pick you up and
Yeah.
kind of correct your posture up here. That's why everything's in spasm right here. And the longer it stays there, like the more these like fibrous adhesions build up, the scar tissue in between your muscles and in between your muscles and skin. And it doesn't allow everything move like it should. Everything should glide over each other.
Yeah, I definitely realized between going to the chiropractor and then going to my family doctor who was checking my back and my arm, both of them told me the same thing, so.
Yeah, I'm sure you've heard it.
Yeah.
Definitely feel this tension coming up all the way up here.
Well, that's
and
what-
this little question mark headache is really typical of this point right here. There's a lot of muscles that attach to the back of your skull right there.
Yeah.
And this point like radiates all this pain right up through here into your temple and behind your eyeball.
Which makes sense why I always have it there.
Mm-hmm. And behind your eyeball can go a little bit deeper to the surface as well. You got a lot of little tiny muscles that attach to the base of your skull that I personally have found are like the root of my migraines personally.
Yeah, I've been getting them since 9, 10.
I've been getting mine for a long time too. I had this nasty little ATV accident whenever I was a kid, broke my neck and didn't know it until I was in chiro school. Oh, if anything gets to be too much, just let me know.
Okay.
Have to get in here, press pretty hard, shake around a little bit. Have to get these
Oh no, good.
adhesions to kind of break up and calm down a little bit. Yeah, probably hurt, but you're gonna be a little sore after this.
Yeah, and drink water.
Yeah. Whenever I get muscles and start moving around and stuff like that, I'll try not to give you much more than like a 5 or a 6 count on those,
Okay.
just so you're not left wondering if we'll let go of you.
It's funny because
Stop
we were going
manhandling
here.
you.
Oh no, you're okay. Nolan was so jealous. He's like, "What do you mean you're going to the chiropractor and Nick's going?"
That's funny.
He's like so stressed out that he hasn't been able to go to the chiropractor. He goes, "I have a friend that goes to the chiropractor."
Guys can bring him in
Oh my
anytime.
goodness, you have no idea. He said he wanted a massage, like a professional massage one time, so I took him to go get one. And he's had a couple now because he's so, oh my, you have no idea.
That's funny.
Like birthdays, Christmas.
That's his thing now.
Oh yeah. Yeah, none of them happy, get him professional ones too. And he just went with me to go get a pedicure. So I took Nick for Valentine's Day.
Kids on a natural high. It's like a natural boat, you know?
Yeah.
It's good. How'd you like your pedicure, Nick?
That was nice.
Oh,
It was good. You just sit there, they like massage your legs, and you drink wine.
I wouldn't mind, honestly. I got a terrible left foot. I don't want anybody like messing with that one.
They touched Nolan and you'll be fine.
I've seen these like random TikToks. I don't know if they're like, you know, like set up or whatever, but like, you know, this girl's like in the pedicure booth or whatever, and like whoever technician is like videotaping her, like recording her feet, like gagging at the same time. Kind of thing. I'm just like, it's funny, but I feel like it's just all made up.
Nick was so funny because I get the regular one. And what did the girl say to you?
I needed the next one.
Heavy duty.
He needed the cheese grater.
It's all good though.
You can go there after work. Take those boots off.
Oh my god.
Let them work on those.
God, no.
I'd feel bad for him.
And tell Holly never to come back.
They would tell me. They'd be like, not only can he not come back, but you can't
You
either.
brought him here.
Mm-hmm. Sorry, am I?
Try not to kill you here.
Oh no, good.
Oof, see, it's some ropey stuff going on back here. A little bit. All kinds of stuff going on out here, ribs and everything.
Yeah, when I do things, I like to excel at them.
Wow. A lot of stuff going there. How does your low back feel? Your low back actually doesn't really feel like acting off.
It's okay. I'll go through periods where like I'll have, back pains, but normally because I have so many like neck and headaches that they go on the back burner. Like I forget about
Goes
them.
down there,
Yeah.
It's a good thing about chiropractic. It's just like you kind of treat the whole system and not just like one or a set of symptoms.
Nick, you have to learn how to do this for other times.
I can't do it on myself though. I don't want to learn if I can't do it myself.
So is his back
That
bad?
would suck. Like, you can't do all this stuff to yourself. Doesn't that suck?
Yeah, it does. It does. Sometimes I think about that. I'm just like, it's like, I don't know, I'm always doing something, always have the excuse that I never have time to go do this, like, for myself.
How's Nick's back?
I mean, it's not
Sorry.
You're pretty tight up in your neck and shoulders, honestly, even though you say you don't feel anything up there most of the time. Nick's mind always goes to his low back.
Oh yeah. I'm surprised he doesn't have neck pain the way he sleeps on pillows.
Why? How do I sleep on pillows?
Like upright.
Not that.
The pillows are like, oh sorry, the pillows are like this and your head's up like that.
Oh, wow. I can't sleep like that. can't pay without it.
Yep.
Hold your breath on that one?
Mm-mm.
Okay. Nice deep breath. Really tight right here. So. Let's get you onto your back. Like, yeah, go face like down, down. Down, down, down. Come on, this way too. Yeah. Give yourself a little bit. Hold up your shoulders right up here. I'm gonna roll you towards me. I'm gonna put my hand under your back. I'm
Okay.
gonna roll you back, and I'm gonna give you a little push through your elbows, okay?
Mm-hmm.
That's just going on. Bend your back right or left wrist right here. Okay. Nice deep breath in and out. Oh my, that is really, really tight right there. Let's get your back over, face down. You okay?
Yeah.
You okay?
I have a high tolerance.
Oh,
Yeah.
okay, well, actually, let's get you to sit up
Okay.
and face this way. Face that. There
This
you
way?
go. Yep. This. I'm gonna put this right in between us.
Okay.
So, what I want you to do is, place your fingers behind your head.
Okay.
Okay. So I'm gonna kind of put you in this wrestling move. I'm gonna come up right here, put my hand right here.
Okay. We used to do this to restrain children. I'm dead serious.
Now bring your elbows in
To-
towards each other. Yep, just like that. Head forward, lean back like this, relax. Squeeze your elbows. You're gonna keep that. Good.
Hey, I finally cracked.
Yeah. Let's go face up.
Face up.
Yep, face up.
Oop, I'm losing
Does
my
nobody
breath.
really crack that normally?
Back this way.
Holly?
What?
There you go.
Does nobody normally crack that part?
Usually it's just, I would always go for my neck and my shoulders.
Oh, nobody, yeah. Did your old doc just adjust like one segment that was bugging you basically?
Yeah. Yeah, it was just, cause I initially started going because of the migraines.
up through the side of your neck here, these like muscles right through here.
Mhm.
Yeah, this might feel just a little bit weird just because I'm really close to your neck. I'm gonna give these muscles right here, I just wanna give them a squeeze, okay?
Okay.
These muscles are kind of, well, they're just two in kind of a little list of muscles that are pulling your head forward like this, like away from like the
Yeah.
pain in your back. If anything's too weird or too
Mhm.
painful, just let me know. You're gonna feel some weird zings probably in your arms and your fingers.
Okay.
Muscles are hard, but they do soften up with a little bit of pressure. Like some muscles just, I mean, it just like feels like pressing on the wall forever.
I'm not that bad.
No. Maybe a little turn this way, just relax your head right in there. Okay.
Mhm.
Okay, and you just let your head relax right in my hands. I'm gonna move you around just a little bit, kind of in the opposite direction these muscles are supposed to pull you in. You guys have a foam roller at your house or anything?
No?
No.
Should we get one?
Might not hurt. It'll definitely help you out over the next few weeks with this like back and neck pain.
Yeah.
What you need to do is kind of get a little bit more extension mobilization. If you come forward, that's flexion. If you look up and bend backwards, that's extension in your spine. And you need a little bit more extension. There's not a whole lot of extension that happens in your upper back anyways, but
Yeah.
because you're slouched forward a little bit, you have to kind of regain that motion that.
And even at work, I mean, because how I usually work, I usually will put one or both my feet up,
Mhm.
and then I bend over.
Yeah, so that's kind of just like mimicking everything like the
Yeah.
way you sleep and like
Mhm.
kind of like the way your body's, I think, preferentially like
Yeah.
kind of sunk into like
Yeah.
at this point.
Like I'll sit in my regular, like my little rolly chair in a, either a Indian position or one of my legs up.
But then I always have to like bend over to get to my keyboard.
Yeah, yeah, okay. I'll have you flip over one more time, face down.
Just losing change everywhere.
Okay, let's put you on your right side, face me this way. We're gonna pull your shoulder out just a little bit, just to get up so you can twist a little bit. Put this butt up into that knee. You good like that?
Mhm.
You okay? Did your other chiropractor adjust you like
Yeah, he
this?
did a bunch of different adjustments, like,
I'm gonna pull you a little bit closer to the edge. Yeah, there you go. Straighten it and then look up. There you go. You okay like that? No
Mhm.
pain anywhere or anything?
no.
Okay. Just wanna pull your hip forward, give you a little twist. That's right there. You okay?
Yep.
Okay. Okay? Good.
Mhm.
All right. Let's go other side.
It's actually the only thing I do is lay on my back and move my foot up to my head so my neck or my
But
back
can you
cracks.
stretch?
Well,
Oh,
no,
your
to crack my
cracks.
back.
Okay. There you go. And then right on your elbow right there. Good. Okay?
Mhm.
Oh, that was a really good one. Okay.
Yeah.
All right, now, yeah, face it. Yeah, let's check out the lower neck first. Stay on that side. Relax. I want to get them just down this way. Turn and then this way. Just relax. Yeah. Step over here, so you need to open this up a little bit. That kind of like corresponds to all these nerves at like the bottom of your
Yeah.
hand. Kind of like.
And that's the thing, like, even when you say relax, like, I try, but I can tell I'm not.
Yeah. It took me a long time to even really conceptualize
Yeah.
I guess the concept of relaxing in somebody else's hands. All the way over here. Give you a little push right here. How you doing? You okay?
Mm-hmm.
That's much better. always explain this concept of like a stack of checkers or dominoes to my patients. Like if you kind of lean it one way at a certain point, you have to kind of go up or down, above or below that, and lean it the other way to kind of keep your center of gravity, right?
Yeah.
So that's kind of what your spine does. Like you're really, really tight them up here, so probably switch sides. And
Over there.
Okay.
Mm-hmm.
Alright. Okay. One more time, face down. Check out your shoulders real fast.
And then you're gonna have to be like, grabbing all the little change, throw it in your.
I like that you're not super busy where you take like 10 minutes and you're like, all right, I'm done.
Yeah, nah, even whenever I get really busy, I feel like I'm going to still kind of take my time and just, that, I mean, that's always been my whole like treatment philosophy, is just like kind of treat the person and.
Yeah.
As it should be.
Yeah, just not, I don't want like a huge high turnover rate. I just want just give people quality treatments, really. And I know how it is too. You go to a chiropractor and it's just like, I want to see you back 3 times next week. I'm just like,
Yeah.
who the hell can do that?
Yeah. I know when I first started going, he's like, that's what it was, 3 times, and I'm like, I can't afford it.
Yeah,
There's
yeah,
so much
same thing
money.
with Kai too. I mean, just had, little Shane at the time and just like, couldn't do that. All right, let's sit you up, see how you feel. You all right? Okay, and, probably.
Be
it's like,
sore
yeah,
or whatever.
You'll be sore and it's not like, unfortunately. Like
Yeah,
at
but
one
I
time,
did
sure,
definitely, there
you're
were
all
different
fine.
times, like I could feel in,
Yeah,
so, yeah.
kind of reproducing your pain at the same
Yeah,
time.
well, it wasn't even pain, it's just like I could feel like that tingle
That
sensation,
nerve
but it was probably
pathway.
like a good thing, you know what I mean?
Yeah,
So.
kind of working on what's causing that compression up there.
Yeah, and I do know the difference since I don't go to the chiropractor anymore compared to when, I was going.
Sure.
Yeah.
Okay, so I told you it's really important to just kind of like reestablish this
Yeah.
motion and this motion, like right there in your shoulder blades, your upper
Yeah.
spine.
Like when I sit at work, I sit like this.
Yeah, at least you know.
Yeah, I'm well aware.
Yeah, okay.
Yeah,
All right.
I'm well
Smart
aware.
girl.
It's just my issue with fixing it.
Yeah, no, I mean, I hear you. It's, whenever it comes to fixing yourself, it's, I don't know, it's some kind of a psychologically daunting task or something
Yeah.
like that. Nobody wants to do it for themselves.
Yeah, because I find it's like more comfortable to sit in the,
Yeah.
by the time I feel it in my back, it's already
Yeah.
been how long?
But that's going back to your body wants to always assume a position,
Yeah.
with less energy expenditure. Like it takes a little bit of energy to like sit up in a correct
Yeah.
posture, and that's why you always, like every few minutes will find yourself like this. You always have to kind of think about it and kind of reset,
Yeah.
which makes you tired at the end of the day, makes you sore in its own way, but.
Yeah, and I
It's,
think ever since like, even with my leg, like now when I sit like that at work and stuff, it's just more comfortable on my foot, so
Sure,
then
sure.
it makes sense for me to do that.
Do your feet touch the ground at work?
No, I usually try and put them up on I have like a little heater on the bottom, so I
Okay.
usually try and put them up on there. But normally I have this foot up all
Yeah,
the time at work,
yeah.
for the most part. Like to the point where my boss is always like, Holly, she's like, cause I'll turn and she's like, you're gonna fall off your seat, cause I do like, I'll hold on to here and then I'll move myself,
Oh, yeah.
like,
Yeah.
you know, feet down,
Yeah.
yeah.
Well, not to call us old, but at the same time,
That's yeah.
we're getting to the point where we need to think about how we're gonna move around at 75.
Yeah.
You know? So,
Well, I already know I gotta take care of him.
I gotta take care of you.
So,
Yeah.
we just gotta think about our posture and, what we're doing
Yeah.
and how we're gonna take care of ourselves and stuff like that.
Yeah.
I see some people moving around now, in their 70s, and I don't want to be like that.
Well, and that's what it is. I'll see like a little lady that's hunched over like that, and then I
You
look
gotta
at
ask
it.
yourself how they get around, how they do stuff, like,
Well, we
how
have a
much
lot of
pain
old
they're in
people,
and stuff.
yeah, in our office, and when you see a little person, it does remind me, like,
Yeah.
You're like,
you
there's
know,
something
yeah.
there's me. You're like, there's me in a couple of years.
I get very weirded out by this, and yeah, in a couple of years, exactly. I'm like 40's creeping up in a couple of months, and it's like, yeah.
Each year goes faster. than the
Well,
last
you're
one,
gonna
just
have
when
to
it's
remind me, even more so. Okay, Nick?
I'll try.
No, you have to. That's your job.
Yep.
It's your
Yeah.
job. Yeah, I mean, to the point where I wear these because the arch of my heel rips every once in a while.
Oh, wow.
So I wear like,
It's real soft
yeah,
shoes.
usually I'll wear tennis shoes until that happens.
Jeez, wow.
Well, thank you. It's your turn.
You're welcome. You doing okay? You feel all right?
Yeah, I feel good.
Good.
Yep.
You want to do quick adjustments?
It's up to you.
All right, man. Lay right down on the
Watch
table.
you. You're fuzzing.
It's called a beard.
No, that's not a beard. That was your beard attracting.
Face down.
Yeah, good face down. So you said you love back's been all right lately?
It actually just started hurting as I was sitting,
Oh,
just probably just because
Watching the other
of the way I
adjustments.
was sitting or something. I'm always hunched over and stuff.
Yeah, this right hip on you is,
But other than that, it's been good.
yeah, that's
It's your milkman
stiff
problems.
boy right there.
Yeah.
Milkman problem.
When I pull the stacks out with my hook, I always pull it with my right, so I don't know if that's.
Yeah, I mean, it could, anything that you're doing like repetitively, you know what I mean, can kind of contributes to your whole like muscular imbalance issues and stuff like that, which kind of perpetuates what we have going on that we feel for ourselves, like the pain that we feel for ourselves. It's all muscular imbalance. I mean, I feel like that's where it starts.
So even knowing that, do you find yourself doing it? Like different things that,
Oh, yeah. I
Yeah.
mean, you just, you sleep in a preferential pattern, you know what I mean? You have to be comfortable. I mean, like trying to change I don't know, I mean, you can try to change your life.
Always
around
sleeps
pain.
like flat on her back. I can't do that.
I used to do that, honestly. I mean, I'll still find myself in the morning, like in the morning around 4 o'clock is whenever I'll lie flat on my back.
yeah. Cause I start out on my side, all huddled in a fetal position.
Yeah.
And then I
Even
lay on
then,
my
I think
stomach
I
a
used
lot.
to lay, more in a fetal position too, but then like, I keep having neck problems after that accident that I had, so I'm aware of how I lay, so at least I'm like straight, kind of
Yeah.
like, I try not to do this when I sleep, cause it'll
Right.
wreck me in the
Yeah.
morning, yeah.
And that's, yeah. Yeah, I don't know how he sleeps, there's like a pillow and his head's all up sideways, and I don't have a clue how you sleep like that.
Nick, let's get you to sit up and face the gray wall too.
Do what?
Face that wall. Yeah. Try one of these adjustments on you. You're bigger than me and way more than me, and but we'll try. Might have to get you to stand up like that. Nah, we'll try like this first. So put interlace your fingers, like put it behind your back, or put it on your head, behind your back. That'd be hard. All right. Hold on, sit down. Jesus, you're looking a lot bigger than me.
Restraining you.
Yeah, squeeze your elbows together. Yeah, bring them together and just relax back here. Good. All right. Face down again.
That was nice, huh?
Yeah, that was a good one. I don't know, it's, for some reason, like, I don't know, I used to adjust everybody like that, and I mean, I just kind of, I don't know, there was a point where I just kind of forgot about it.
Yeah, it definitely helps.
Right here, nice deep breath in, and out. Maybe there wasn't. All right, let's see if we can get that adjusted on you, so face me this way.
Like sitting down again?
No, on your back, or on your side, lay on your left side, yeah, face me this way. Good stuff, all right. Scoot your back hip away from the edge of the table. Got some long legs, buddy. That was it.
Yeah, that was good.
Good stuff. This one's up, there you go. All right, get some good ones today.
Yeah, I think I cracked more that way than any other time.
Yeah, go face down again. Good stuff right there. You're already cracked. That's why you gotta come regularly.
Nimble.
Wait a
Yeah,
couple of
'cause
months and
then
stuff,
you-
and it's
yeah.
just like, I mean, it's shocking, like, whenever you get adjusted after a couple of months. Come over here. Give it a little push. Oh, there's a bubble right there. Good thing we did that.
Make your body be ready for it.
Maybe it was. I think he was ready for it last time. He just didn't get all of these adjustments that he was getting this time. Man, doing it right. Good.
Yeah, most of the time I'm tough to crank.
Yeah, go.
You're welcome.
Go face up.
I need a butt
Massage later. Calm you down or something like that. Be in there. Bring her up every time. Yeah. You get it on. I'll get this strap. Get one here. You want to do this one?
What is
I'm
it?
kidding.
I'm like, I don't know what's about to happen.
So this is a Y-axis distraction. People call this the Y strap, not because it looks like a Y, and maybe because it looks like a Y, but I mean this is a Y-axis on your mathematical table, like
Okay, yeah.
X-axis, Y-axis. So this is like a long axis distraction. This is pulling you apart, like all of your joints and
Ah.
decompressing the spine. Okay, right there.
Mm-hmm.
How's that feel?
Good.
Give you a little stretch. Give you a little stretch to where it goes down your back a little bit. Little pull.
Oh, you should do that.
Do you feel like your spine came out?
I like it. Hold it
Yeah,
forward.
yeah.
Make sure you just all it.
Thank you.
We'll eventually get there.
I think that's my favorite thing though.
Yeah.
I think, yeah.
I need to, honestly, like, it's been so long since I've had a really good pull. I need to like get
Yeah.
one of my friends around here and just get my head pulled off. Like,
Oh, yeah, it's
yeah, yeah, it clears up. That's, it's really, really deep, like, it can be a really powerful adjustment. I mean, it can adjust all the way down into your
Oh,
like
okay.
sacrum and stuff like that, clear up a lot of stuff that a lot of practitioners just can't touch with their hands and stuff like that.
Okay.
Yeah,
Huh.
it's really good. Feeling all right? You doing all
Yeah.
right, man? You did good, man.
Yeah,
You
I
did good.
yeah, I cracked everywhere today.
Yeah, you guys did good. I appreciate you guys coming in.